I'm Andrea Dourado, and this is my assignment 1, Skin Cancer Treatment. Hello, I'm Andrea. How are you today? Let's talk a little bit about your lesion and your surgery. The basal cell carcinoma is one of the most common type of skin cancer, mainly caused by cumulative and intense sun exposure. It happens when skin's basal cells are abnormal and grow uncontrollably, or when lesions arise in them. When diagnosed and treated early, metastasis does not occur. That doesn't spread to other tissues and is not a life-threatening. The Mohs surgery is the most effective technique to treat basal cell carcinomas. During the surgery, thin layers of cancer skin are gradually removed, and each sample is immediately examined by the doctor at the microscope. This process is repeated until total removal of the cancerous cells. The surgery is performed by a surgeon who is specially trained to remove cancerous tissue, to analyze the lab specimens, and close or reconstruct the wound. The goal of the Mohs surgery is to remove as much skin cancer as possible, doing minimal damage to healthy tissue. It's usually done on an outpatient basis. The anesthesia is local, and after, the surgeon will make a local incision in order to remove the visible cancer and a small margin of surrounding healthy tissues. As the surgeon examines the removed samples during the surgery, the chance of cure increases, also reducing the need of additional treatments. Because it's not possible to specify the size of the skin tumor just by looking at its surface, it's advisable to book an entire day for the procedure. However, in general, the Mohs surgery takes just a few hours. At the time of surgery, firstly a preparation is made by a doctor or a nurse who cleanses the surgery site, outlines it, and injects a local anesthetic in the area. The anesthetic will avoid any kind of discomfort during the surgery. After, the surgeon uses a scalpel to remove the visible part of the cancer. For a few minutes, a bandage is placed on the incision while the doctor examines the removed tissue at the microscope. A detailed analysis is performed. Meanwhile, you can wait in the waiting room, can eat, you can go to the bathroom, you can read a book, etc. You just cannot leave the clinic because if the cancer remains, the surgery will continue. After surgery, it's very important to take care of the wound properly, following all doctor's instructions to avoid local infections. The size of the scar will depend on the amount of tissue removed. But don't worry now, because as I said before, one of the techniques of this surgery is to remove the tissue affected by cancer, causing the least damage possible to the healthy tissue. Do you have some question? Now, we need to schedule your follow-up to remove the stitches. You will come back in a week, but if you have any need as pain, for example, you can call us to make a new earlier appointment. Have a good day.